joined by Dr. Michael Telisak. He is with PCI in Cedar Rapids. He is an otolaryngologist, an ear, nose, and throat doctor. And coming up here on Monday, the 25th, you have a free screening for oral head and neck cancer. Good morning, doctor. Why is it so important for people, especially coming out of the coronavirus times, why is it so important for people to resume the normal cancer screenings that they had been doing prior to COVID-19?
Good morning. So I really think with the coronavirus pandemic, people were afraid to come in for routine care. So there actually is good scientific data that there's a lot of people that had worse outcomes from heart disease, which is probably the most common cause of death in the United States, or one of the most common causes for older people. And then on top of that, things like cancer, which some of it very preventable if it's caught in time, gets missed because people are afraid to come in because of the coronavirus. So it's good that things are opening up a little bit where people have more opportunities to come in and be evaluated when they have a problem.
Obviously, this is open for everybody, but is there a target audience who are looking forward to come in to get the screening for oral head and neck cancers?
Yes, there is. So generally speaking, oral head and neck cancer comprises about 66,000 cases a year in the United States, and typically people that smoke or drink alcohol, particularly drink more alcohol in general, or have a long history of drinking alcohol, have a higher risk of oral head and neck cancer. Additionally, skin cancers of the head and neck with sun exposure is a risk factor. And then generally people over the age of 50, men more than women, tend to get affected more by this cancer.
Gotcha. So when you're doing these, what exactly happens? So when I walk in, just sort of walk me through the process when I come in.
Sure, absolutely. So myself or one of my colleagues will be examining you in that situation, and we're just taking a good look at your head and neck, really anything, kind of including the hair-bearing area and all the way down to the neck, and looking at the skin, the nose and the throat, the tongue, those areas, the back part of the throat, and feeling the neck for any lumps or bumps that we're concerned about, and then asking about some symptoms, how long the symptoms have been going on, that kind of thing.
Gotcha. For something like this, I mean, this is a free screening, and it doesn't matter. I mean, really, if you're Cedar Rapids, Marion, heck, if you're in the Quad Cities listening right now and you want to make a day of it, you can come up for this and do some shopping as well. How many people do you expect to see and come through during this event that's coming up Monday, the 25th, from 3:30 to 5 p.m.?
Generally, this is very well attended. Of course, there's always the worried well that just want to be screened and evaluated. But really, our goal for this is there's people that don't always have the opportunity to come to the doctor because of cost or other reasons, and or just time and work. And we try to make this open so people that have those risk factors or have a lump in their throat for a month and haven't had it evaluated by a doctor, or a lump in their neck, or some other kind of concern, some sign there that they're concerned about, that they can be evaluated appropriately.
Now, I do need to make sure that people know they have to reserve the free screening. You can call the Nassif Community Cancer Center, 319-558-4876. I'll put that number in the show notes again, 319-558-4876. Hey, Dr. Telisak, thank you very much for taking the time to join us here to talk to us about this free screening event for oral head and neck cancer over at PCI, all right?
Absolutely. Have a great morning.
All right. You as well. Take care. That's going to be going on over at the PCI Clinic Medical Pavilion at 202 10th Street Southeast. It's within the Nassif Community Cancer Center over there. 6:44 now in the morning show.